roller. We're just gonna start off with a simple big three: hips, spine, shoulder girdle. Here we go. First one is just sit on the thing. Can you make sure you have enough balance? Then we're going to work on one side of the hip, like your glute piriformis area. So what she did here is she went over to her side, crossed that leg, that hand is gonna go to the ground, and this leg right here is going to push and pull. She's gonna go up and down on the foam roller. Now, the whole thing might hurt if you're not used to doing the foam roll, or you might feel like a fish out of water, everything just kind of feels funky. That's okay, that's normal. Typically the first 2 weeks of this is kind of hard, but what you're gonna do is, if this is new to you, just go up and down 10 times. That is just kind of scanning the tissue. Now, if you're a little bit better at it, then I want you to go really slow and then stop where you have that little tension. You typically will feel it. Hold pressure on it, breathe through it. I like to kind of move that leg up and down, kind of dig that spot out of there. I like to call this one a pin and stretch. You're pinning down that tissue and then stretching that tissue around that area. Might take a little bit for it to release, but you should feel that thing get really, really tight, and then it'll start to kind of dissipate. When it does, I typically kind of go up and down just a little bit, just to kind of clean it out, and then I move to the other side. Is going to be your thoracic spine, so where your ribs are attached to. What you're gonna do is put your butt on the ground, put this thing in between your shoulder blades, and you're just gonna use your legs to roll back and forth on that mid-bite. You might feel some little popping or clicking in that. You're okay, you're not gonna hurt anything. Your thoracic spine is supposed to be mobile. So what she's doing here is just supporting her head, just so her neck's not tight, and then just going up and down, getting some good motion there. Then what I want her to do is put her butt on the ground, and then now she's just going to extend over the foam roller. Go ahead. So what she's doing is focalizing that area of the spine where the foam roller is at, just to get some localized extension through there. I typically like to have a few, just kind of stretch that thing out, and then what I'll do is either move up or down the foam roller to get a new area, and then focus on that area. Now think of it, when she's opening up her rib cage, air should be going in. It's expanding the ribs. So take a nice deep breath in, and then kind of collapse and breathe out. If you're sitting at that computer all day or driving or whatever, you're kind of slumped over, this is going to help open up that chest and thoracic spine area. You just got done doing the thoracic spine. Now we're gonna hit in between the shoulder blade and the spine. It's in this little teeny area right through here. It's like your rhomboids, your traps, you're just trying to get that, because if the shoulders are rolled forward, you'll get all little knots all through this area. So what she does is she's just gonna lay back on it like she did on the second one. And what she's going to do is bring one arm across her chest. So what that's doing is moving that shoulder blade out of the way, making more room. And then now she's gonna lean to that side and kind of get that mid-back trap area that we showed earlier. This one, you typically have to bring the butt up a little bit higher so you can drive more weight into it. The only thing I would say is if you have long hair, be careful, you'll run over your hair. Or if you have a hoodie on, it'll run over that hoodie and about choke you. So don't do those things. She supported her head with the other side. That's just if your neck is really tight and you don't want your neck to get tight while doing a foam roller, which is trying to help decrease your pain and symptoms. She's gonna go up and down, get that movement in there, but then I want her to go really slow, find that little knot, and sit there and dig into it. She can kind of move this arm around and sit there and kind of like open up that tissue, do that pin and stretch type technique. This is our big three for our foam roller: your hips, the spine, thoracic spine, and your shoulder blade area. So try to do these every single day. This is something that is a building block for us. I always tell people this is like brushing your teeth, but for your spine. This is gonna be one of the foundational moves, so don't forget it and do it.